Have you ever found yourself just completely falling down the rabbit hole of men's health info online?
Oh, yeah. It is. It's a lot to navigate.
It really is.
Yeah.
Like if you are managing your own health care, you know exactly how overwhelming this can be.
Right.
You look up one specific treatment, and suddenly the signal-to-noise ratio just drops to zero.
You're instantly hit with aggressive marketing.
Exactly. Aggressive direct-to-consumer ads, dubious claims, and then all this complex pharmacokinetic jargon that honestly you'd need a medical degree to properly understand.
Which is incredibly frustrating for the average person.
It is. But for this deep dive, we are bypassing all that noise entirely.
We are. And we have a really excellent compass for this process today. We're operating as an audio extension of the iMedix platform.
Right.
For those of you who use their database, you already know iMedix functions as an independent medical information repository. Their whole mission is to empower patients.
Yeah, they do the heavy lifting.
Exactly. Their editorial boards provide these rigorously structured, medically reviewed resources to demystify treatments. They establish clear safety protocols, aggregate real patient data. It basically provides the necessary friction to slow down and actually understand what these compounds are doing to human physiology.
Which is exactly what we want to do today. And the specific case study we are extracting from their database is a comprehensive review of a generic medication called Suhagra.
Specifically, the 100 milligram formulation.
Right, the 100 milligram. And the documentation covers everything. I mean, we're talking precise dosage titration, severe contraindications, nuanced systemic side effects, and even user-reported outcomes.
It's a gold mine of data.
It really is. But we want to approach this, we don't just want to read a static list of warnings, right?
Oh, definitely not.
We want this to be an exploration into how our bodies work, how these specific molecules navigate metabolic pathways, and really the psychology of intimacy.
That is the optimal framework. The goal here is to push way past that surface-level package insert.
Because anyone can just scan a list of side effects.
Right, but we need to examine the biological why. Why does suppressing one specific enzyme trigger localized blood flow, but also potentially cause a profound whole-body drop in blood pressure?
Yeah, that's the fascinating part.
And why are certain drug interactions categorized not just as mild warnings, but as absolute, potentially fatal red lines? By unpacking the anatomy of this drug from the molecules on up, we build a much more comprehensive picture of its real-world impact for you.
Okay, let's unpack this. Let's start with the blueprint, the foundational pharmacology.
Sounds good.
So the compound in question, Suhagra, it's a generic medication manufactured by a company called Cipla Ltd.
Right.
And the active ingredient is sildenafil citrate, which, for anyone tracking this stuff, sildenafil is the exact same active ingredient found in the famous brand name drug, Viagra.
Establishing that chemical baseline is critical. When we discuss Suhagra, we are fundamentally discussing sildenafil.
They are biologically equivalent.
Exactly. It's a bioequivalent generic. It has to demonstrate the same pharmacokinetic profile as the reference drug. Now, its primary clinical indication is treating erectile dysfunction, or ED. But to understand how it works, we have to look at its drug class. Sildenafil is a PDE5 inhibitor.
A phosphodiesterase type 5 inhibitor.
Right.
And since we know you, our listeners, follow these pathways pretty closely, let's look at the actual mechanics of what a PDE5 inhibitor does.
Let's do it.
The iMedix clinical breakdown notes that the erection process is driven by the release of nitric oxide in the corpus cavernosum, that's the spongy tissue in the penis, during sexual stimulation.
Right, and that nitric oxide is the spark. It activates an enzyme which then ramps up levels of a molecule called cGMP.
Cyclic guanosine monophosphate.
That's the one. And cGMP is the crucial signaling molecule here. It tells the smooth muscle cells lining the blood vessels to relax.
Which opens everything up.
Exactly. It causes vasodilation, rapid arterial inflow of blood, which creates the erection.
Basically a plumbing analogy, right?
It really is.
You can't get good water pressure if the pipes are all constricted. The cGMP relaxes the pipes, so the water, or blood, in this case, can flow freely.
That's a great way to visualize it. But the body is always trying to maintain balance, homeostasis. It needs a way to reverse that process and turn the water off.
And that's where the PDE5 enzyme comes in.
Exactly. PDE5 is the specific enzyme that degrades or breaks down the cGMP. It's the body's natural off switch.
So if you take a PDE5 inhibitor like Suhagra, you are blocking that off switch.
Precisely. You are competitively binding to that enzyme. You aren't creating the erection directly. You're just preventing the body from breaking down the cGMP.
You're keeping the pipes wide open.
Right. You shift the enzymatic balance to favor prolonged arterial engorgement.
Which brings us to a really major misconception.
Mm.
And the iMedix database spends significant time dissecting this.
Oh, the aphrodisiac myth?
Yes. So Suhagra is not an aphrodisiac. It does not cause an automatic erection just by swallowing the pill.
And that is non-negotiable for patient safety and expectation. The drug only aids the physical response to existing sexual arousal.
Because it treats the mechanical symptom, not the psychological desire.
Exactly. The drug has zero action on the central nervous system mechanisms that govern libido. It doesn't touch dopamine or oxytocin. Arousal starts neurologically.
In the brain.
Right. Sensory input, psychological state that sends a parasympathetic signal down the spinal cord.
So if there's no initial arousal,
There is no nitric oxide release, and if there's no nitric oxide, there's no cGMP for the sildenafil to protect.
so the pill just circulates through your system, gets metabolized, and leaves without doing anything at all.
Exactly. It requires the spark.
And that ties into another profound warning from the source material. This medication does not cure the underlying causes of ED,
Right. It's symptom management.
which is a critical point for anyone evaluating their health.
Mm.
ED is rarely just an isolated issue. It's often a warning sign, a canary in the coal mine for other physical factors.
Cardiovascular disease, atherosclerosis, diabetes.
Right, because the penile arteries are much smaller than the coronary arteries.
Significantly smaller. So if you are developing systemic atherosclerosis plaque buildup, hardening your arteries, those tiny penile vessels are going to get clogged in symptomatic way before your larger heart vessels do.
So if you just take Suhagra to fix the plumbing.
You might be ignoring a massive red flag for a future heart attack.
Wow.
Yeah. It requires a comprehensive diagnostic workup. You have to manage the root cause, the blood pressure, the lipid panels, the blood glucose.
Okay, so assuming a patient has done that workup and a doctor decides Suhagra is appropriate, we get into the art and science of dosing.
The tiered approach.
Right. The iMedix guidelines don't just say take a pill. They detail a very specific protocol, 25, 50, and 100 milligrams.
And calibrating that dose is the core of rational prescribing. You want the exact concentration that preserves enough cGMP without oversaturating the entire body and causing side effects.
So why is 50 milligrams the typical starting point?
It offers the best clinical balance. For the median patient demographic, 50 milligrams provides a high probability of efficacy while keeping the adverse event profile tolerable.
Okay, but what about the 25 milligram dose? Because the database is very specific about when that is used.
Yes, the step-down dose. That is primarily used for patients with altered drug clearance rates.
Meaning their bodies process the drug slower.
Exactly. For older patients, specifically those 65 and older, your liver and kidney functions naturally decline.
So a standard 50 milligram dose would stay in their blood much longer.
Right. It would result in a significantly higher concentration in their plasma. To prevent toxicity and exaggerated drops in blood pressure, you start them at 25 milligrams.
The source also mentions using 25 milligrams for people with liver or kidney impairments or those on interacting medications.
Same exact rationale.
And then there's the ceiling, the absolute maximum recommended dose, 100 milligrams.
And that is a hard ceiling. It's prescribed when 50 milligrams is tolerated well but just isn't effective enough.
But you shouldn't just keep taking more if 100 doesn't work.
No, absolutely not, because of enzyme selectivity.
Right.
Once you hit 100 milligrams, you've essentially reached receptor saturation. All the available PDE5 enzymes in that target tissue are already inhibited.
So taking 150 or 200 milligrams won't give you a better result.
It won't improve the erection at all. What it will do is spill over. The excess drug loses its selectivity and starts inhibiting other enzymes throughout the body, which drastically amplifies the severe side effects.
Okay, so stick to the prescribed dose. But here's where it gets really interesting to me. The practical reality of taking the pill.
The timing.
Yeah, it needs roughly 30 to 60 minutes to work. But the iMedix database has a very specific warning about high-fat meals.
The classic steak dinner sabotage.
Exactly. Let's talk about that. A romantic, heavy dinner can significantly delay the onset of the drug,
Why? Because sildenafil is highly lipophilic.
meaning it dissolves in fats.
Yes. So if you take the medication on an empty stomach, it moves quickly through the stomach and absorbs rapidly in the small intestine. You hit peak concentration in about an hour.
But if you just ate a ribeye steak,
The presence of all those complex lipids triggers your digestive system to slam the brakes. Gastric motility slows way down to digest the fat.
so the pill is just trapped in your stomach.
Trapped, and because it's lipophilic, it binds to those dietary fats, it completely blunts the absorption rate.
So the onset isn't just delayed, the whole absorption curve is flattened out.
Exactly. The peak concentration is lower, and it can take hours longer to hit that peak. For the patient, this means extreme unpredictability. They might think the dose failed, only to have it kick in hours later.
Which obviously disrupts the whole window of efficacy, which is typically, what, 4 to 5 hours?
Roughly 4 to 5 hours, yes.
The iMedix FAQ contrasts this directly with its chemical cousin, Cialis, or tadalafil.
Right.
Cialis has a window of up to 36 hours.
That structural difference in the molecules completely changes the patient experience. Suhagra is strictly an on-demand medication. You have to plan intimacy within a tight temporal window.
Whereas Cialis allows for more spontaneous behavior.
Exactly. Patients really have to choose based on their specific lifestyle.
Okay, so let's shift to what happens when this drug is actively circulating, because it's not just acting on the pelvic region.
No, it is a systemic medication.
Right. Let's navigate the system-wide reactions and side effects. The expert speaker, well, you rather were explaining this earlier, and what's fascinating here is the everywhere effect of vasodilation.
Right. If a drug dilates blood vessels, it doesn't just neatly target one single area. PDE5 is concentrated in the corpus cavernosum, sure, but it's also present in the smooth muscle of blood vessels all over your body.
Which perfectly explains the most common side effects listed in the database. Headaches, for instance.
Very common, and it makes perfect sense. You are dilating the cranial arteries. Expanding those vessels increases localized blood volume, which triggers pain receptors in your head.
What about facial flushing? That redness and warmth people get.
That's just the vasodilation of the superficial capillary beds in your face, neck, and chest.
And nasal congestion. That one always seemed counterintuitive to me.
It does seem strange, but think about the mucosal tissues in your nasal passages. They are highly vascularized. When those tiny vessels dilate, the tissue swells up and mechanically obstructs your airway.
Ah, so it's not mucus, it's just swollen blood vessels.
Exactly.
The database also lists dizziness and indigestion.
The dizziness is orthostatic hypotension. Your blood vessels are wider globally, so your overall blood pressure drops slightly. If you stand up too fast, your system takes a second to compensate and you feel dizzy.
And the indigestion.
PDE5 is also found in the lower esophageal sphincter. Inhibiting the enzyme can cause that sphincter to relax when it shouldn't, letting stomach acid creep up.
Oh,
Heartburn.
okay, so those are the common, fairly tolerable effects. But then we get into the sensory disruptions, the rare stuff.
The PDE6 anomaly.
Yes, this is fascinating. Why does an ED pill affect vision and hearing?
Because while sildenafil is highly selective for PDE5, it's not perfect. It has a slight affinity for an enzyme called PDE6.
And where is PDE6?
It is exclusively found in the retina of your eye, specifically in the rod and cone photoreceptor cells.
So it directly interacts with how our eyes process light.
Yes, it plays a role in phototransduction. Because sildenafil mildly inhibits this enzyme, some patients get a distinct blue tinge to their vision.
Synopsia.
Right. Or they become very sensitive to bright light. Now, for most, it's mild and goes away as the drug wears off.
But the iMedix database flags a severe warning for patients with retinitis pigmentosa.
Because that's a genetic disorder that already mutates the PDE6 genes. Their photoreceptors are already compromised. Hitting them with a PDE6 inhibitor is a huge risk.
And beyond that, there's a severe risk of NAION, sudden vision loss,
Non-arteritic anterior ischemic optic neuropathy.
which is terrifying, and sudden hearing loss, too.
Right. The theory there is that the sudden systemic drop in blood pressure reduces blood flow to the incredibly delicate microvessels in the optic nerve, or the cochlea in the ear. It essentially starves the nerve of oxygen.
Which is an emergency.
An absolute emergency. If you experience sudden vision or hearing loss, stop the medication immediately and get to an ER.
And speaking of emergencies, we have to talk about the urological emergency, priapism,
Yes.
an erection lasting more than 4 hours.
I cannot stress enough how serious this is. It is not a joke. It is a severe medical emergency.
Because the blood is trapped.
Exactly. The venous outflow clamps shut, the blood becomes trapped, it loses all its oxygen over those 4 hours, and it becomes toxic to the tissue.
It can lead to permanent tissue damage.
Ischemic necrosis.
Yeah.
The tissue literally begins to die and form scar tissue. And the tragic irony is, if left untreated, it results in permanent, irreversible erectile dysfunction.
That no pill will ever fix.
Right.
The database specifically notes a high risk for men with sickle cell anemia, multiple myeloma, or leukemia.
Because of blood hyperviscosity. In sickle cell, the red blood cells deform and physically block the veins, making drainage impossible. Those patients have to be incredibly careful.
Okay, that brings us to section 4 of our deep dive. The absolute red lines, the contraindications and dangerous interactions.
A fatal mix?
Yes, let's treat this with the utmost seriousness. Suhagra has an absolute contraindication with nitrates.
Under no circumstances can these two be mixed.
Nitrates like nitroglycerin for angina, or even recreational drugs like poppers.
Right. Let's look at the deadly cascade here. Nitrates are prescribed to manage chest pain. They work by rapidly flooding the vascular smooth muscle with nitric oxide.
Which, as we learned earlier, drives the production of CGMP.
A massive amount of CGMP, causing profound whole-body vasodilation to take the workload off the heart.
But if you introduce Suhagra, a PDE5 inhibitor, into that environment,
You've eliminated the body's ability to break down that surging CGMP. The nitrates are opening the floodgates, and the sildenafil has blocked the drain.
so your blood pressure just bottoms out.
Completely bottoms out. Profound hypertensive drop. The cardiovascular system loses all resistance. This leads to fainting, heart attack, and potentially death.
And the enzymatic pathway doesn't care if it's a prescription heart pill or a recreational popper at a club.
The chemical reaction is exactly the same. It is a fatal mix.
Okay, what about alpha blockers, like tamsulosin or Flomax, used for enlarged prostates?
Alpha blockers also lower blood pressure by relaxing muscle tone in the prostate and blood vessels.
So taking them with Suhagra is doubling up on blood pressure-lowering drugs.
Right. It's not the catastrophic shock of nitrates, but it carries a very high risk of orthostatic hypotension, getting dangerously dizzy or fainting when standing up.
Which is why doctors drop the Suhagra dose to 25 milligrams in these cases.
Exactly. You have to be stable on the alpha blocker first, and then start at the absolute lowest dose of sildenafil.
And that highlights why full disclosure to your doctor is so important, which extends to your diet incredibly. Let's talk about the grapefruit juice phenomenon.
This is a textbook pharmacological interaction.
It just blows my mind how a simple breakfast juice can alter medical outcomes so severely.
It's all about an enzyme in your liver and intestines called CYP3A4.
CYP3A4.
Yes. That enzyme is responsible for breaking down sildenafil so it can be cleared from your body.
And grapefruit juice blocks that enzyme.
Compounds in grapefruit called furanocoumarins don't just block it, they effectively destroy the enzyme. Your body has to synthesize entirely new ones, which takes days.
So if you drink grapefruit juice and take your 50 milligram pill,
The drug enters your system, but there's no enzyme to break it down. It builds up to highly toxic levels in your blood.
so that 50 milligrams starts acting like 150 or 200 milligrams.
Exactly, which massively increases the risk of severe side effects, the drops in blood pressure, the vision issues, the priapism.
The database also mentions other CYP3A4 inhibitors like the antibiotic erythromycin and ketoconazole.
Same mechanism. They suppress the clearance pathway.
The last major warning here is about the cardiac workload itself.
Right. Sex is a cardiovascular workout.
It is. It requires an increase in heart rate and blood pressure.
And if a patient has severe underlying heart failure, a recent stroke, or uncontrolled high blood pressure, the physical exertion alone is dangerous.
Add a vasodilator to that.
Yeah.
And you're asking the heart to pump harder against a widened vascular network.
The cardiac workload can easily outstrip the oxygen supply to the heart. If a doctor has advised against sexual activity for cardiac reasons, this pill is not a workaround. It's highly dangerous.
Okay, moving into section 5, the human element. Because this isn't just molecules and enzymes, it's psychology, it's relationships.
It deeply impacts human behavior.
Let's talk about psychological dependence. The source mentions the hidden danger of performance anxiety.
Yes, a man might have a mild temporary issue, take the pill and get a great result. But then he forms a cognitive association. I cannot perform without this pill.
Which creates a self-fulfilling cycle of anxiety.
Exactly. And the biology of that is fascinating. Remember how we said arousal starts with the parasympathetic signal? Anxiety triggers the exact opposite. It triggers the sympathetic nervous system, the fight or flight response.
Adrenaline and norepinephrine.
Yes. Norepinephrine binds to receptors in the penile blood vessels and causes powerful overriding vasoconstriction.
It actively clamps the blood vessels shut.
The anxiety physically creates the dysfunction. The sympathetic tone is so strong, it overrides the parasympathetic signal. So even if Suhagra is in your system, there's no initial nitric oxide release for it to protect.
The anxiety neutralizes the drug.
Completely, which is why addressing the psychological side is just as critical.
That's incredible. And speaking of psychology, there's a profound paradox discussed in the FAQ regarding antidepressants.
Medication-induced ED.
Yes, Drugs meant to cure mental health, specifically SSRIs for depression and anxiety, frequently cause physical erectile dysfunction.
It is a deeply frustrating clinical paradox. SSRIs increase serotonin in the brain, which is great for mood, but elevated serotonin actively inhibits sexual desire and the downstream signals needed for an erection.
So you need Suhagra to fix the physical side effect of the mental health drug.
It highlights the sheer complexity of modern pharmacology. It's a localized peripheral intervention to overcome a central neurological block.
Let's ground this science in some human reality.
Hmm.
The iMedix database actually curates user reviews.
Right, to show the real-world impact.
We have Desmond's story. He wrote, "My wife and I had issues because I couldn't satisfy her sexually. It has really enhanced the sexual intercourse."
That narrative highlights the heavy emotional and relational toll of ED. It's not just a physical symptom, it degrades intimacy in marriage.
And he mentioned only finding out about it through a friend, which shows how much stigma still exists.
Yeah.
Men are embarrassed to tell their doctors.
Which delays vital cardiovascular screenings, like we talked about earlier.
Exactly. Then there's a totally different take from a user named JimRat77. He just said, Suhagra is a reliable choice.
Highly pragmatic. For him, it's just a mechanical aid. It shows the vast spectrum of patient experiences.
And a user named Zach simply wrote, "Thank you for what you do," directed at the iMedix team.
What's really impressive there is the iMedix moderation team's response. They are incredibly empathetic to Desmond's struggles, validating his experience.
But they also maintain clinical boundaries.
Right. They seamlessly integrate medical caveats, reminding users that everyone responds differently and that doctor supervision is absolutely necessary.
It's a very responsible way to handle medical support online.
Absolutely.
Which brings us to our final section, the global market, generics, approvals, and safety. There is a very specific nuance here regarding Suhagra's status.
Yes, the not approved status.
Right. The active ingredient, Sildenafil, is completely FDA approved. It went through phase 1 to phase 3 trials. But the specific brand, Suhagra by Cipla, is listed in the iMedix database as a non-FDA approved generic.
This raises an important question for the listener. What does that actually mean?
Yeah, if the chemical is approved, why isn't the pill?
It comes down to regulatory jurisdictions and money. Cipla is an Indian pharmaceutical company. Suhagra is fully approved by the Indian regulatory authorities.
But they just didn't file the paperwork in the U.S.
Exactly. Filing an abbreviated new drug application with the U.S. FDA costs a massive amount of capital. Cipla likely focuses their market strategy elsewhere.
So legally, in an American database, it has to be marked not approved.
Right. It's an unapproved foreign brand of a fully approved chemical.
So why do Americans seek it out? Economics.
Cost is the driving metric.
Suhagra is significantly more affordable than brand name Viagra.
And for underinsured patients, the cost of domestic pills is insurmountable, which pushes them into the wild west of online pharmacies.
And this is where the severe warnings about counterfeits come in.
You cannot trust sketchy online vendors. The risk is exponential.
The spectroscopic analysis of seized counterfeits is terrifying.
It is. You might buy a pill marked 100 milligrams, but it actually contains 200 milligrams of sildenafil, guaranteeing a hypotensive crisis.
Or it has 0 active ingredient.
Exactly. And the manufacturing facilities lack basic sanitation and safety standards. They find commercial printer ink, toxic talc, heavy metals, completely unrelated, highly dangerous chemicals used as binders.
So the message from iMedix is clear. Get a valid prescription and use a licensed pharmacy. Saving a few bucks is not worth organ failure.
Absolutely not.
Briefly, who specifically cannot take this drug?
The clinical data strictly contraindicates it for women, especially pregnant or breastfeeding individuals and children under 18.
Because there isn't robust safety data for those demographics.
Right? Which contrasts with the older demographic, 65 plus, who can take it safely with medical supervision and adjusted dosing.
The source also mentions a totally unrelated use of sildenafil, which I found fascinating. Rivakio.
Ah, yes. For pulmonary arterial hypertension or PAH?
It's the exact same chemical, right?
Exact same. PAH is dangerously high blood pressure in the pulmonary arteries of the lungs. And because PDE5 is heavily expressed in the pulmonary vasculature,
The sildenafil lags there too.
it selectively dilates those lung vessels, lowering the blood pressure and taking the strain off the right ventricle of the heart. It just shows the versatility of the molecule.
It really does. It's a systemic modulator, not just a casual supplement. Well, let's synthesize this journey we've been on. We started from the complex microscopic mechanics of PDE5 inhibition.
The NOCGMP pathway.
Right. And we mapped how that specific localized vasodilation works. We explored the rigid dosing protocols and how a heavy steak dinner can completely sabotage your timing.
We covered the system-wide effects, the headaches, the flushing, and the dangerous interactions with nitrates in grapefruit juice.
We looked at the profound impact this little generic pill has on human psychology, performance anxiety, and real relationships, using the lived experiences from the iMedix community.
And we established the real dangers of the counterfeit market.
This deep dive was brought to life by the independent medical information provided by the iMedix platform. They exist to help readers like you better understand your health and safety.
They provide that crucial analytical framework.
Before we sign off, I want to leave you with a brand new, forward-looking question based on everything we've read today.
Let's hear it.
We know that sildenafil targets a specific enzyme to increase blood flow for ED. And we briefly saw it can be used to lower blood pressure in the lungs for pulmonary hypertension.
Right, highly selective vascular opening.
Exactly. So it makes you wonder if this medication is so incredibly effective at selectively opening up vascular pathways in specific parts of the body. What other hidden applications for aging, tissue repair, or even cognitive blood flow might scientists unlock from this compound in the decades to come? Could it delay Alzheimer's by increasing blood flow to the brain?
That is a compelling frontier. Systemic endothelial rehabilitation is a massive area of research right now.
It's definitely something to think about. Thank you for joining us on this deep dive. Stay curious, stay informed, and we'll catch you next time.